This week on the BackTable Podcast.
Yeah, I think as I've gotten further along, I spend more time with the guidelines, partly because they're the most up-to-date. But I think also I've realized that studying the guidelines just makes me a better resident and more, I think, independent in making decisions. I think there probably is a study tool slightly lower yield than something like doing questions, but I think they're definitely worthwhile. And of course, I don't just read them. I make them into flashcards and use an app, Anki, which sort of has a smart algorithm for spaced repetition, which helps you drill down to what you really need to learn.
Hello, everyone, and welcome to the BackTable Podcast, your source for all things urology. You can find all previous episodes of our podcast on Apple Podcasts, Spotify, and at backtable.com.
Okay, Gina Bottolato here, welcoming you all to the next iteration of our BackTable Urology Podcast series. This is a series where I am interviewing different trainees across the country about their experiences during urology residency. Dr. Lindsay Hampson from University of San Francisco, also program director urology there, is co-hosting with me for many of these series. She can't be with us today, unfortunately, so I'm flying solo with our next episode. For those of you who missed our last episode, we did interview Max Bowman from UCSF also, who talked about leadership strategies and functioning as a chief resident and effectively leading a team during residency. So I'm really delighted to kind of open up our next series, which is really about maximizing your learning, both clinically and in the operating room throughout residency. And I'm delighted to have one of our star residents from Columbia with us today. His name is Dr. George Moran. He's a chief resident, and I'll have him introduce himself. So, George, tell us about yourself.
Thanks, Gina. Thanks for having me. Yeah, I'm a PGY6 urology resident at Columbia, where I was a med student as well. So I've been training in some capacity in New York for 10 years now. But I'm heading to Chicago in June for pediatric urology fellowship at Lurie Children's.
Awesome, George. So you've been such a star throughout your 6 years with us, even earlier, starting back to medical school, and done so much, both the institutional level at Columbia and also some national projects you're working on to help residents with learning, that we thought it would be great for you to come on today. The first thing I wanted to ask you about was really more about medical knowledge. So residency is so time consuming, so demanding, so exhausting. How did you keep up and kind of continue to grow your medical knowledge throughout training? Was this a trial and error process? How did you do that?
Yeah, I think there's so many different types of knowledge that you pick up during residency, and much of it's on the job, and some of the more didactic stuff you need to seek out a little more deliberately. I think I can say with the power of retrospection that the slope on the job learning curve is constantly changing. And that's kind of the first piece of advice that I'll give anyone on this topic. There are times when you're just totally maxed out with your day job, learning how to be a consult resident or preparing for your first major cases. And you're learning a ton in that time, even if it doesn't always feel like it. But then there are times when you're kind of in a rhythm at work, and those are good times to dig in and try to build your fund of didactic knowledge. And I think that was honestly probably my trial and error process, just early on, kind of spinning my wheels, trying to study or do research at times when I was totally maxed out at work, and then setting myself up for failure and struggling to meet the goals I'd set for myself. But ultimately, the good rhythm came when I was sort of trying to maximize my didactic learning during the less demanding times at work, be that, on a clinic rotation or nights, and then having sort of clear, achievable goals for review and retention during the more demanding times at work.
Yeah, totally reasonable. You've got to modulate your activities with your kind of work expectations, but also your own goalposts depending on what the demands you're facing are. So in line with what you were saying about setting expectations and modulating your pace based on what rotations you are on, what resources did you find particularly valuable for different study aids?
Yeah, that's half the battle. I was a history major in college, but in spite of that, I have a really hard time learning from books alone. So I'm all about sort of assembling the right mix of resources. And I think that's definitely a personal thing, but I'm probably not alone in the experience of having a hard time achieving deep focus when I'm exhausted or studying in the hospital, worried about what I'm going to do the next day. So I tend to be less a book chapter guy and more find ways to make studying loud and flashy kind of guy. Early on, I benefited a lot from video lectures. The UCSF COVID series is really great, as is the Empire Urology one. I recognize that you and Dr. Hampson are the leaders of those two initiatives.
Yes, Dr. Hampson and I are very happy to hear that.
I promise that's not pandering. It just happens to be the truth. But I think when you're approaching a topic for the first time, it's really helpful to hear someone talking about it. If you think about things that you don't see in your early residency, things like workups for azoospermia or metabolic stone disease, there's so many variables of varying importance. But when you hear an expert talk about their thought process for the first time of working up a patient, you sort of implicitly pick up on the hierarchy of facts, what's most important versus what may be incidental. And that helps you sort of prioritize your knowledge within a topic, which I think is an underrated first step in all of this. By contrast, I think the stuff that makes it into print, whether it's the guidelines or new literature, isn't necessarily going to be the building blocks you need to develop an understanding of a topic, nor will it necessarily hit at the appropriate depth for a resident to learn about a topic for the first time. An exception to that is the AUA core curriculum, which tends to, I think, hit at a really good level for us residents. And ultimately, the guidelines are the gold standard, but I think for some of us, it can be a tough place to start. So I think videos, core curriculum helped me get my feet under me. And then after that, the SASP questions are just the best. I think being challenged for the question and then having a really concise explanation for both the right and wrong answers is huge. I know a lot of people use the app. I make myself a spreadsheet where I put the answer choices or my answer choices for the, say, 15 questions I'm doing that day. And then when I get one wrong, I force myself to write in about one sentence why my answer is wrong and why the correct answer is right. And I think that's a pretty good exercise to force yourself to avoid the kind of hand waving one tends to do when you're tired or distracted. I'm also a big believer in what I'll call the breadcrumb trail, which is I sort of take notes just in the margin of a textbook, and I force myself to go back to those notes every time I get a question wrong. So then every time you return to a topic, you're reintroduced to the thought process you previously used to understand something. I think that's key for sort of laying some tracks in your head. And then I'm a big diagram guy too. I just sort of try to draw out as many diagrams or schematics as I can. So for oncology, that ends up being a lot of flow charts for clinical decision-making based on risk groups and whatnot. For things like stone disease, it's putting different things in buckets. So the types of stones you can see with hyperuricosuriasia and what differentiates them, the different etiologies of hyperoxaluria. And then for nephrology and things like neurogenic bladder, I'll actually draw out the nephron and spinal cord and make a map of where the pathology takes place, all to sort of make the knowledge a bit stickier. So it's not just one thing, it's a bunch of things, I guess.
Yeah, that's great. Those were all great tips. I think you're kind of highlighting the versatility of modern learning. In the past, it was all textbook, maybe purely didactic-based type of learning. This next millennial generation of learning, which you're part of, is really drawing from different resources, audio, visual, things multi-institutional, and using some of the new innovations from the AUA apps and interactive platforms like question and answer to kind of solidify that knowledge. So I think that versatility that you highlight and using all those kind of pockets of information and combining them is a great way to learn and to keep it fresh. So those are all great pieces of advice.
I think also it's not as if we residents are studying under ideal conditions, well slept in a quiet place with a clear head. So you have to sort of level with that reality. And there are some times where watching a video and being a little passive is all you can tolerate. And there's times when, you have to do something that's gonna require your engagement and your buy-in with, whether it's flashcards or questions.
Totally. Those sound bites or things you can read on the subway for those of us New Yorkers here.
Right.
You kind of alluded to this already, George, but do you have any specific advice or a study plan when you're preparing for the annual in-service exam? Anything more you want to add about that?
Yeah, I tend to make myself a schedule, and it's less about sticking perfectly to the schedule as it is guaranteeing yourself that you're going to end up where you want to end up. And you may have a week of late nights and fall behind on your schedule, but at least your deficit and what you need to do to catch up. So I'll chart out, a couple months in advance. Every week I'm going to do X number of questions, X number of flashcards to make sure I'm being comprehensive.
Yeah, I think we've had these conversations before, but this idea of doing questions, doing some of the self-assessment study questions that is marketed through the AUA, doing a certain number of those questions, and then as you said, understanding the background material is a great way to prepare. And this is all to get you a good foundation for when you will sit for your qualifying exam through the ABU in a couple of months when you finish your residency. So good to really give it your all on some of these in-service exams every year. What about your approach to self-study throughout your residency? So how did this change as you move from being a junior to a senior resident, since we have different people at different stages of their training listening to this?
Yeah, I think as I've gotten further along, I spend more time with the guidelines, partly because they're the most up-to-date. But I think also I've realized that studying the guidelines just makes me a better resident and more, I think, independent in making decisions. I think there probably is a study tool slightly lower yield than something like doing questions, but I think they're definitely worthwhile. And of course, I don't just read them. I make them into flashcards and use an app, Anki, which sort of has a smart algorithm for spaced repetition, which helps you drill down to what you really need to learn. Other than that, I think just as you get later into residency, the premium is more and more on organization, because I think your hours may decrease, but your administrative tasks increase. You're applying for jobs, fellowship, probably doing more research. So I think that I just become more and more dependent on good organizational habits.
Yeah, awesome. And there's always that opportunity to just learn from what you're doing at that time. So if you're a busy junior resident and you have a consult on something that you didn't quite know very much about, that's your opportunity to read and let that inform what you're doing. And I think that George has mentioned some of the great resources that you kind of have at your fingertips if you're learning on the spot. So there's structured learning, and then there's the applied learning of just working in the hospital from day to day. And sometimes that's how we start off early in our career when we're busier. And then let's switch gears a little bit and talk about, so we talked just about pure medical knowledge, right? And now a big part of residency is the technical surgical training. So how do you prepare for cases in the operating room? Do you have a strategy for that?
Yeah, that's been a trial and error process over the years. But I think the way I do it now, I start with the history of the patient, review the imaging, and then after that, I have an approach that's not dissimilar from how I study. Ideally, there's a video to review on YouTube or from a case my co-residents and I have recorded, just to kind of give yourself the overview. And then after that, I'll get into the nitty-gritty and try to force myself to list the steps of the case. My co-residents and I share notes that are essentially annotated op notes. I find that if I force myself to generate the steps by writing them out myself, I set a much higher bar than if I just read and review. So lately, what I actually do is I'm preparing for a case the day beforehand or the night before. I'll just write myself an email with sort of the patient information, my interpretation of the imaging, and then I'll just try to write the steps out. And I'm far from an expert in the sort of pedagogy or neuroscience behind this, but I do think that forcing yourself to kind of generate that really is much more, again, is a much more exacting kind of higher bar to set than just reading. Probably slightly personal as well. I think some people, and I envy them, are probably able to read and internalize something at any given moment. But I find that writing it out helps.
That's great. You mentioned so many things like reading the op note, watching videos. You mentioned keeping like an atlas that you edit with your peers and your co-residents and updating that. So I think that those are all great pieces of information. I love the collaborative aspect of it. I didn't realize you were working with your other chiefs to generate that. So is that something that you think you could hand down to the next generation of residents?
Oh yeah, we certainly do. And they're all live documents, so they all can be updated. Yeah, it's critical, and it's a team effort. So very important.
Love that. Well, we know that it's not always kind of black and white. The same surgery might be different when it's being done by a different attending surgeon. So some have different teaching styles and grant varying degrees of autonomy. What are some strategies that you have to keep learning and getting the most out of the experience, accounting for those differences in people that you work with?
Yeah, that's a really great question. And it's so critical to what we do as residents and how we progress. And I've been reflecting on this a lot. And I think I learned early on that a big part of the benefit of working with attendings who granted me more autonomy, even in the simplest cases, It wasn't just that I did more in the case, but that I prepared much more for those cases. Because I knew that if I looked like I knew what I was doing, they would just let me go. So I've taken that lesson and sort of run with it. And now I try to prepare for every case as if my attending won't even scrub. And that really forces me to prepare well and take nothing for granted. So I'm yielding something from those cases, even with attendings who like to do more themselves, because I've gone through the exercise of preparing, which is not quite the same as doing the entire case yourself or the major portions yourself, but it allows you to I think, gain a lot from that experience.
That's great. I think kind of you turn the question on its head, and it's really not maybe that faculty member, but the confidence that you have going into the case and how well prepared you are can kind of set the tone. So,
and I'll say this happens, I think, to a lot of us. There is that attending who really likes to do a lot of the case themselves, and then one day you show up and you're granted a promotion and you're sort of permitted to do much more. And there's no worse feeling than not being prepared for that and not being worthy of that promotion. So I try to avoid that.
Yeah, it's about
happen
building.
at any time.
Yes, you want to be that person that earns that trust in that moment for sure. Well, I wanted to, focus on this because you've really done a lot in this area with Dr. Chris Anderson at Columbia, at an SAU, a Society of Academic grant. You have a robotic simulation program. The acronym is GAMERS, and that stands for G Alliance for Maximizing Education from Robotic Simulation that you started. Tell us a little bit more about this program and how do you think it will kind of improve and augment the resident surgical trainee experience?
Yeah, thanks for asking. So this is a project we actually started during COVID, which was the end of my second year at residency, when none of the robots were being used and not much surgery was being done. So my co-residents, Ezra Margolin, Connie Wang, and I started a round-robin competition where we chose a few virtual reality exercises and had resident teams compete against one another for the best average score. And people got really into it. And for someone like me who still had his main robotic training years ahead of him, it was a great way to get introduced to the skill set and build some confidence. I was a rower in college on the crew team, and we would practice for like 3 to 5 hours a day doing the same 2 to 3 second long rowing stroke over and over and over again before we showed up to the line for a race. So to me, the idea of see one, do one, teach one for something as technically complex as surgery has always been kind of crazy. And Justin Lee, who's been a co-leader on this with me, was a college fencer. So I think we came at this with similar backgrounds, both pretty thoughtful about technical training and kind of understanding that in the kind of modern era, we as trainees have to come to the OR more prepared. And this all felt very, very worthwhile as an area of pursuit. We also had really great mentorship and support from our PD and APD, yourself and Chris Anderson, whom you mentioned. Anyway, after we did that VR competition, we thought this idea had legs and was worth sharing. And we also felt like the VR stuff, for all its ease of use, fell a little short in terms of how much it actually recreated the feeling of doing live surgery. So we made our own dry lab curriculum to supplement it. So we now have a growing series of these self-scored modules that trainees can do on the robot with super basic supplies like gauze and sutures and tea bags and Foley catheters. And we've run 2 seasons worth of tournaments at Columbia. And as you mentioned, we got a grant from the Society of Academic Urologists to continue to expand it. So that's been a really nice vote of support and helped us out a lot. And we're recording this on the 7th of April. And tomorrow we're starting our pilot into residency gamers competition. So I'm pretty excited about that. Tomorrow's a big day. In terms of how it'll augment training, I think there's a lot of benefit to gamifying the pre-OR training for the same reason that I think studying questions and flashcards is the most effective way to study for a lot of people. By making this a game for points, you can focus trainees' attention on very specific technical objectives and capture their attention by putting points and pride at stake. So you end up practicing like you play rather than just sort of messing around with a trainer and then having the first real time you feel any pressure to perform be in the OR at the time of surgery. I also think it's just an opportunity to have fun, build some camaraderie, do a little friendly trash talking. And I also like the idea of kind of putting out in the open the fact that you actually have to practice to get better at surgery. I think that's something that we don't always talk about all that much.
That's great. Leave it to yourself, a former varsity rower, and Justin, a former fencer, a very high level, to make robotic training into a competitive sport. Can you share the website, or how would people get more information if they want to learn more about your curriculum right now, even if they're not enrolled in your current competition?
Yeah, absolutely. Thought you'd never ask. I'm going to pull up our actual, can we link the URL or the Twitter handle with the episode? Let me see if I can, rather than, it might not make total sense for me to read out the URL, but here it goes. So it's bit.ly/robot-gamers.
Awesome. And then I know that you have an X handle that we're sharing to get more information as well.
So that's where we have a website there where we basically link to videos of how to set up the modules, an expert robotic surgeon completing the modules, and then scorecards for each of them so you can do them and score yourself.
Yeah. What I love about this is that it's not just the competition aspect. I think you mentioned it, but it's also like it's not expensive. These are not fancy items. These are household materials where everybody can potentially use these materials in a creative way that you're describing to understand essential and critical maneuvers for robotic surgery.
Yeah, totally. I mean, the barrier to entry has to be low because most of us are doing this stuff, between cases at the end of the day when a case is canceled. So the idea is that this should be stuff that's super easy to set up, but high yield and kind of grabs your attention and makes your training very, very worthwhile.
Awesome. And you can do it while competing against some of the co-residents across the country. Well, these are really pearls of wisdom that I know that you didn't wake up with. These are things that you learned throughout your 6 years of residency. And I hope that a lot of people really take this to heart and maybe incorporate it into their practice as well as their training. Is there anything we missed? Any closing advice you would give to people who are really looking for ways to optimize their training?
Yeah, I mean, I think the two more big things rather than specifics, because I do think that the specifics of how you learn can be quite personal, and it's helpful to identify people you feel you're similar to and ask them how they learned. But I think in terms of big picture things, number one is what I've sort of already mentioned, which is just try to, recognize the times when you're really all your attention is at work and it's a bit of kind of a rope-a-dope. You're just kind of getting through your day job, and the yield from that you will realize once you get a full night's sleep and let it all sink in, and then recognize the times when things might be a little lighter and you have a chance to kind of to dig in on your kind of self-improvement, if you will. The other thing is, I think just we should all recognize that we're training in a unique time. On the one hand, we're hopefully all lucky to work with great mentors who've accrued enormous amounts of knowledge from careers worth of experience, and that's just invaluable. So try to stay close to those people, but also recognize that we're facing challenges, particularly our time. There's more ways to do surgery than ever before, more therapeutics, more trials. So there's a ton to know and master, and the standards for things like surgical autonomy and work hours are obviously different. So it's on us to be creative and adapt to meet our generation of trainees' particular set of challenges. So
yeah, that's so true. I think that challenge doesn't end with residency. It's really it continues later on in your career. How do you incorporate new technology, new information into your practice? So the paradigms that you set up now, they be things that you continue with your entire life. And I think the other key points you brought up was kind of just understand that you're busy, right? And so forgive yourself. You're learning in a different way than you learned in medical school, where you may have had blocks of time to study, but you're talking about carving out chunks of time that are free. Maybe not ideal. Maybe you're a little exhausted, but using that time to maybe do a couple reps on the simulator, or read a little bit more about that patient you saw, or look on your app of the guidelines. So these are little things that you maybe can do every day to keep yourself on your toes. But again, it's different.
Totally. But I think finding the rhythm that sustains you, recognizing that it's going to be your individual mix, that's key, because look around at our mentors and see that it doesn't stop at the end of residency. Don't I know it? With the boards coming up.
Yeah, and Pete's fellowship coming up, but you're ready. I know that. Thank you, Dr. George Moran. That was a pleasure to spend this time with you, kind of pick your brain. and have you share this with everybody in the audience. This is a great installment, again, for our trainee BackTable series. We're looking forward to more to come. I know Dr. Hampson really wishes she could be here today, but will be with us for the next series. She's kind of my partner in crime here. We look forward to our next edition. And with that, we'll end today. Thanks so much, George.
Thanks for having me.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _backtable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
And Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter, Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.